Hello, everybody, and thank you for joining us today. I'm Courtney Rao, Senior Manager of Market Intelligence and Commercialization at McKesson. It's great to see you all here for our Advisory Services Lunch and Learn with TaylorMed, part of our ongoing series that we launched this year with our preferred vendors. Today, I'm pleased to introduce Erin Bragg, Director of Services at TaylorMed, and her partner from Highlands Oncology, Melissa Fell, Director of Revenue Cycle. As a quick reminder, please make sure your microphone and speakers are muted. The Lunch and Learn will be recorded, and we'll be sending a link to view the recording and presentation slides shortly after the event. Feel free to drop in questions or comments in the chat section. If there's time, we'll open up the floor for a brief Q&A at the end. And for any other questions, you can reach out to your sales rep or email advisoryservices@mckesson.com. Please welcome Erin and Melissa.
Thank you for the introduction, Courtney. To start, I'd like to tell you a little bit about our organization, Highlands Oncology Group, or HOG. We are a nationally recognized cancer provider here in Northwest Arkansas. We have 4 clinics serving approximately 8,000 patients per year. Our clinics offer access to advanced treatment options, multidisciplinary teams, as well as industry-leading clinical studies. As part of our mission, we are committed to helping patients overcome financial toxicity and affordability receive their vital treatment. Now I would like to tell you about our efforts before we implemented a technology solution. We had an existing program in place to help connect patients with various forms of financial assistance. Our team of financial counselors are responsible for identifying patients in need and securing assistance for them. However, our success was limited by manual processes, which included a combination of spreadsheets, sticky notes, and emails to match eligible patients with assistance and track about 800 enrollments per year. Our financial counselors also had to print out daily schedules and manually reconcile them to flag financially at-risk patients, as well as prepare assistance applications before their visits. We wanted to take the financial assistance to the next level, so we decided to explore a technology solution. Our top goals were to transform our workflow. We wanted our counselors to be able to work proactively rather than reactively. This meant having the ability to flag financially at-risk patients and match them with available assistance on the front end before they were faced with a bill they couldn't afford. Automatic our processes. Just an automation. As I mentioned, we were relying on a lot of different inefficient labor-intensive processes, which drained our counselors' time and capacity and limited their ability to maximize available funding. This was especially problematic when it came to foundation assistance, where funding windows typically open and close rather quickly, sometimes within minutes. We wanted to streamline and expedite matching and enrollment. We also wanted to amplify our impact. We knew that if we could optimize our efforts, it would benefit our patients as well as our organization. And when patients are better able to afford treatment, patient experience, adherence, and other outcomes improve. And it means lower rates of uncompensated care and bad debt and increased revenue, which boosts our practice financial health. So we wanted to ensure we assisted as many patients as possible and secured as much assistance as possible. We selected TaylorMed as our end-to-end financial assistance solution. TaylorMed integrates with our EMR and uses predictive analytics to proactively flag patients in need. It then streamlines the process of matching and enrolling them in financial resources, drawing on 7,000 programs. We implemented the TaylorMed platform at the end of 2020, and we quickly achieved strong results. These results included achieving a return of investment within 28 days, an 18% revenue increase during the first half of 2021. We expanded our reach, assisting more patients than we had ever before, time saving of 3 hours per day per financial counselor on visit preparation, and we also significantly increased our program approvals. At the end of the presentation, there will be a QR code for visibility of the case study results for any questions about percentages you might have. We were really happy with our results, but some key challenges remained. We were seeing rising patient volumes in our clinics, meaning our counselors had more patients to assist. While the technology improved efficiencies, our counselors were still spending a significant portion of their time on program enrollment and claim follow-ups. This limited their ability to meet with many new patients as possible. They wanted to be able to focus on what really matters, which is the patient, instead of the back-end processes. Now I'm happy to hand it over to Erin Bragg from TaylorMed, who will share how her team helped us address these challenges.
Awesome. Hi, everybody. Thanks, Melissa. Before I tell you about our collaboration with Highlands Oncology, I'd like to give you an overview of our TaylorMed Complete solution. I am the Director of Services here at TaylorMed. TaylorMed Complete is TaylorMed's tech-enabled support service, which pairs TaylorMed's technology with the hands-on financial care. Our team of expert financial navigators and claims processors bring more than 75 years of combined experience in various healthcare settings. We provide expert support to supplement the work of an organization's staff. What this means is that we're combining tech power with people power to amplify success. Working with Highlands and other organizations, our TaylorMed Complete team offers a consultative approach. We partner and collaborate with internal teams to help them take their financial assistance efforts to the next level. We take an in-depth look at their current processes and around financial assistance and then help them standardize those processes. We also help with change management. Now, I'll tell you a little bit more specifically about how we tailored our program to work with Highlands Oncology. So currently we have 2 TaylorMed Complete financial navigators and 1.5 FTE of copay claims processors currently supporting Highlands' 8 in-house financial counselors. Our TaylorMed Complete primarily handles assistance program enrollments and claims processing and follow-up. Down here on the pink, all those pink boxes, you'll see a very high-level overview of the workflow that we've established with Highlands Oncology, beginning with our referral from the Highlands Oncology financial counselors. What's really nice about that is they are the boots on the ground. They are the folks that are seeing and talking to their patients every single day. So to be able to have that connection still remain with their patients while utilizing the tech-enabled people power solution works really well. So in addition to receiving those referrals, all of that patient data flows into the TaylorMed software for my team to review as well. Once that patient comes in and our software matches the patient to a program, a detailed review is completed by my TaylorMed Complete team, and then the consent is gathered from the patient. The enrollment is then completed by the TaylorMed Complete team, and then TaylorMed Complete always documents in the EMR for visibility. So the TaylorMed Complete team is unique in the way that we are all remote, helping to standardize and lift up these programs for folks like Highlands Oncology. However, we still want to be able to have that connection with the folks who are the boots on the ground. Melissa's 8 financial counselors. We want them to be able to see and know exactly what they're doing. If a patient walks in the office and asks a question, we want them to be able to look in the chart and see right exactly kind of where we're at in the process. So TaylorMed Complete then follows each applicable date of service to submit a copay claim. So when a patient is approved, my team is going to keep track of all of the potential dates of service for the patient and then follows those until the primary payer pays, and then a copay claim can be submitted. Copay claims are then monitored for approval and posting accuracy. Of course, you can get a patient approved for a program, but what good is it to the patient or the organization if those dollars aren't actually realized? So a lot of work is put into making sure that those claims are approved and posted to the correct accounts. All right, and now I'm going to hand it back to Melissa, who will share what Highlands has been able to achieve with this combination of technology and expert support.
Thank you, Erin. We did see excellent results last year after partnering with TaylorMed Complete team. With those results, it included a 35% increase in the number of patients we assisted in 2023 compared to 2022, a 37% increase in the number of assisted program approvals in 2023 compared to 2022. Last year, we also secured $1.2 million in claimed copay assistance, which benefits not only our patients, but our organization's financial health. In 2024, we're on track to exceed last year's results. During the first half of this year, we saw a 45% increase in the number of patients we assisted, a 42% increase in assistance program approvals. We've already secured $1 million in claimed copay assistance, and we're optimistic about the results for the second half of the year. First and foremost, this combined approach of technology and expert support has positively impacted our patients. By reaching more patients in need and maximizing the assistance we're able to secure for the team, we've boosted affordability and reduced financial toxicity. This means more patients can afford the treatment they need, so they don't have to choose between necessary living expenses and life-saving care. This leads to improved adherence and better outcomes. By optimizing assistance, we're enhancing the patient experience. Studies have also shown that a patient's financial experience is a critical part of their overall satisfaction with a healthcare provider. We're committed to providing positive financial experiences. In addition to helping our patients, the partnership has benefited our team and our organization as a whole. With the TaylorMed team handling back-end processes, our financial counselors are now empowered to do what they do best, which is to see many new patients as possible and provide hands-on financial care. This has enabled us to reach more patients in need and secure more assistance for the patient. Overall, our program is now fully optimized with the right technology, processes, and people in place. As our CFO, Mike Gebhardt, said, we can now provide a compassionate and higher quality financial navigation experience to more of our patients, which is consistent with who we are as an organization. This goes back to our values and the fulfillment of our mission here at Highlands. I'm going to hand it back over to Erin, who will discuss next steps and best practices for organizations that are looking to optimize assistance. Thank you.
Awesome. Thanks, Melissa. It's awesome to see those impressive results for both your patients and your organization. But looking ahead, we're optimistic about our continued partnership with Highlands. As we mentioned earlier, Highlands is on track to exceed last year's results. We're excited to keep improving our workflows and processes to meet the needs of this super fast growing program. So for recommendations and best practices, if your organization is looking to level up your own financial assistance program, we recommend taking a close look at how you're handling in the following areas. Number one, processes. Do you have a proactive process in place so that you're flagging financially at-risk patients on the front end and matching them with available assistance before they face a bill that they can't afford? Are your processes around financial assistance centralized and standardized, or is your program siloed with processes varying by department and service line? This is something we see pretty frequently. You know, there's multiple teams often handling one process, and that's kind of where the ball gets dropped typically. And people, do you have the right team of people in place to handle financial assistance? Financial counseling and financial navigation is a very unique subset of skills. Your folks have to understand a lot of different areas and really understand the whole patient journey to be able to help in ways that will impact the patient and the organization the most. Is the assistance being handled by financial navigators and or other professionals who have the knowledge and skills to comprehensively evaluate savings opportunities and match eligible patients? Like I mentioned before, we can get patient approvals, but if there's no dollars on the back end, what good is it to the patient or the organization? So having somebody to be able to really dig in to find out what the benefit to the patient and organization will be is paramount. And then finally, technology. Do you have a technology solution in place, or is your team relying on manual, labor-intensive workflows like Post-its and spreadsheets to manage your assistance? I think at some point we can all relate to spreadsheets and Post-its, but there are other things available now to help us streamline that process. So asking all these questions will help you to determine how mature your program is. But for a deeper dive into your program's maturity, we invite you to take our maturity assessment by scanning this blue QR code here on the right. This is a quick survey that will only take a few minutes of your time. You'll get an instant snapshot of where your program stands, plus a free consultation with one of our experts. Feel free to scan that code now and you can take the survey if you'd like while we finish up here. We also encourage you to scan the pink QR code on the left, which will give you a link to our full case study with Highlands Oncology Group so that you can learn more about our partnership and results. And I am now happy to take some questions from the audience. If there are any, I'm just going to take a look here. Looks like, thank you, Alex and Melissa, both already, you got them squared away.
Erin, I can help you too. I can call out some for you.
Okay, that would be wonderful.
It looks like we did have one question surrounding some of the statistics for Highlands. It's asking, was the 1.2 million in claim assistance direct to your bottom line, or was a percentage of this returned to TaylorMed for their work? And are you able to provide the number of patients that were aided to obtain the 1.2 million?
Melissa, do you want to take that one?
Sure, yeah. So I'm not sure exactly in the case study if the number of patients were on there, but I do not have an exact number of patients in front of me, so I apologize on that one. The percentage of the return to TaylorMed, Erin, did you want to speak on that a little bit more?
Yeah, so our the way we structure our solutions, our tech-enabled people power solutions vary. But yes, there is a return to the TaylorMed team for the work that they put in, and it's different. It's varying for each organization. So we typically work in what we call a shared savings, which is kind of what I think, Walter, you're alluding to. So where we're both winning in the when we're exceeding goals.
Absolutely.
I think the patients, I don't have the patient number right on top of my head, but I think it's somewhere close to 800, if I remember correctly, from last year.
Thank you.
Yes, and please feel free to come off of mute and ask any other questions that you may have. Otherwise, I was kind of interested, Melissa, how did it impact the number of patients the Highlands team was able to see on a daily basis?
Yeah, sure. So again, it's kind of the bottom line for us. We wanted our financial counselors to spend more time with the patient, not necessarily behind a computer screen, kind of looking at all of the claims back end. So in doing so, and this might answer some questions, we actually had to double our financial counselor team in order to do so. We actually started with a low number of financial counselors of 4, and we actually doubled that number to 8. And that is a team that continues to grow, and we look forward to continue growing that team here at Highlands so that they can best serve the community, our patients, and then, of course, work alongside TaylorMed to get more assistance for those patients.
Excellent. Has your team grown since inception?
It has. Our team as a whole, when I began at Highlands 2 years ago next month, we had 34 people in the business office, and we have grown that to approximately 70 for 2024. And again, it's an area that we continue to grow because naturally, healthcare, we continue to evolve. We find, new complexities where we need to add more staffing, of course, more patients, coming in the door. So we're continuously growing.
Do you know what those new positions were?
So some, they were, let's see. We were actually looking into some for appeals and denials. Like right now we have our, insurance representatives. We need to kind of branch off of that a little bit. So we're looking into some of those newer positions. The other positions were just basically adding to different, different areas of like the prior authorization department, the insurance department, verification scenarios. So it's just continuous growth for us.
Perfect. So if you're brand new to financial navigation with no employees dedicated to the role, where do you recommend the practice starts and how?
Well, I think it really starts, and I think this is kind of where we just, leaned on TaylorMed. We were doing an okay job, with our financial counselors, but again, we weren't able to see all the patients, coming in the door. We needed that extra help. And I don't want to sound redundant at all, but it was a focus on what can we do to utilize, as many patients and get to as many patients as possible. And that's where we really quickly ventured into learning about, programs like TaylorMed that could really help us focus on the back end process so that we could add more patients to the financial counselor schedule so that we could actually meet with the patient.
I will say too, at a very high level, if you're starting out and you don't have any idea kind of what financial navigation is, I think it's important to first identify what are your goals. What are you looking to achieve? Do you want to reduce your bad debt? Do you want to reduce your days in AR? Do you want to provide this patient benefit, cost avoidance, copay programs? So identifying at the very highest level what your goals are will help you to understand and you can even start small. You can start in little buckets, subsets of these patients. Maybe it's your Medicare only patients and you want to focus on them. In terms of finding folks to do the job, I think that is probably where, understanding what financial navigation is. There's lots of educational tools out there to be able to help, organizations figure out who do we need to hire to do this job. But understanding what your goals are will help you to kind of narrow down where you can start with the program and also the employee.
Thank you. Okay, well, if there aren't any other questions, Erin or Melissa, any parting words? Oh, it looks like we have a question.
Yeah.
Susan?
Yeah. Hi, this is Susan. Quick question. What are the main tasks or responsibilities of financial counselors at your location where it requires patients to be seen with financial counselors from the front end?
Yeah, that's a great question. So our financial counselors really focus on new patients and really looking to give them a good faith estimate based on their regimen type. So we really like to work proactively in meeting with those new patients. Of course, sometimes we don't get them on day one because they do need that regimen in place. But when they start that regimen, that's when our financial counselors can really work with those patients on the good faith estimate. They'll sit down with them, explain their benefits of their insurance policy, and then kind of go over, say if it's a self-pay patient, then they'll work out, any payment plans that they have and go from there. So that's really where we try to utilize our financial counselors for those new patients. Again, it's just for, the upfront good faith estimate.
Okay. Do you also have a prior authorization team in addition to the financial counselors?
We do, absolutely. We do.
Okay.
Yeah, our financial, and the way we're kind of structured here, just to give you a little more insight, our financial counselor teams ideally are set up on the first floor in close proximity to our check-in desk. That way it doesn't have, the patient going from floor to floor. They can pretty much check in, and we use a platform, Phreesia, that kind of helps alert the patient in the front desk to actually shift that patient to the financial counselor. And then everyone else in our business office, we're up on the fourth floor. So we're kind of a lot of the back end processes, and we use our financial counselors for that true front end process.
Any additional questions? Yes, Walter.
So with that staffing model that you have, Melissa, how many patients do you estimate annually that you're servicing?
Wow, annually. That's a really great question. I know we have 4 locations. As mentioned earlier, we, try to reach like 8,000 or so patients a year. Naturally, we're not going to catch all of those patients, but we on average see between our 4 locations I would probably say our financial counselors are on the upwards of seeing, 60, 70 patients a week.
Okay. And one final question on that. Rough estimate, what percentage of that of your total population is having to have the financial navigation process for those patients? Is it half? Less than half?
That is a really great question. I would foresee probably, I would at least say half. I think that's a fair, estimate, maybe a little bit more. And it's just to basically, because sometimes we have patients that don't necessarily understand their insurance. So we'll pop in and have those patients go see a financial counselor just to get that extra explanation of, what is my insurance? What does an out-of-pocket mean? What does a deductible mean? So we have a lot of our financial counselors seeing a lot of patients just on basic questions. Again, it's not just for the good faith estimate, but they're also there for educating the patients, which I sometimes feel like patients, and not to their fault, but patients lack. And so that's where financial counselors can really be helpful, is just in an overall education of the insurance. So that's where we really utilize our financial counselors as well.
Thank you.
Sure. Thank you.
And Aaron, it looks like we have a request for an example of what a center of excellence or steering committee looks like. Do you recommend certain, roles, whether it's financial navigators, social workers, RCM staff, are a part of it, so it's a collective group?
Yeah, I think, if I could have it my way, everybody in the cancer center or organization would know about financial navigation. I think it's that important. And we're talking about Highlands Oncology Group right now, but financial navigation is not specific to cancer, right? Every patient that is going through some sort of medical care could benefit from talking to a financial navigator, like Melissa said. I would, say maybe even 90% of patients, it seems very high, but don't understand their insurance benefits. And a lot of the time, when you call a patient, and if I'm calling a patient to just give them an example of a program that I have pulled up for them, they will say to me, well, what do you mean my insurance approved this? They really just don't understand the process of getting charged and billed and what that looks like for them. So having everyone from the doctors down, pharmacists down, and obviously the revenue cycle staff on board to know, number one, what's available to your patients. At Highlands Oncology, everybody knows that there's financial counselors there and that they can refer a patient to them if they have a simple question, because sometimes that's all it may be, or it may be a bigger, deep, in-depth look for that patient. And then in which the financial counselors can reach out to my team and say, hey, we think this patient might be eligible. Can you take a look at that? That's really the bulk of time that it takes, is like Melissa said, their financial counselors are no longer stuck behind computers looking up programs and enrolling patients into programs and making multiple phone calls and tracking down these dollars. But yeah, I think as many people you can get involved, the better. If you can start with your CFOs and work your way down, I think that's the best way to go. We do see a lot of organizations, though, that start maybe in their pharmacy. Their pharmacists are the ones, their pharmacy leaders really want to know about how they can help their patients. And I do think, understanding where to start is one place. TaylorMed, we came into Highlands Oncology, they obviously had an established program. They were doing really well, as you can see in the results that Melissa shared. But having the ability to come in and have, sort of a consultative approach and say, hey, what are you doing today? How can we help make this better? And you're leveraging the platform, but how can we leverage it even better? Because, offsite, we're not on site. My team is unique in the way that we are in the platform, TaylorMed platform software, all day, every day. We know the nuances. And so, an on-site staff, financial counselor, may have, those interruptions. Somebody comes in to talk to them. They have patients coming in all day long. So being able to say, how do we want to structure this? What parts do you want your team to focus on, Melissa? What part do you want my team to focus on? Has really kind of paved the way for us to streamline the whole process. And of course, like we mentioned, it's ever evolving. We know healthcare is ever evolving, and the way insurances work is ever evolving. So to be able to be flexible, both of our teams are flexible in the way that if something changes, we change our workflow to kind of modify, and then, the growing patient volume as well at Highlands Oncology.
Great. Any more questions?
I have one. You said you have 8 financial counselors and they apply for grants for your patients. Okay, so Cancer Care, when they open up, they are all on, you do it online or you have to call them. How do you handle that when you only have 8? And if you have more than one company that's with you, how do 8 of you handle that?
That's also a great question, which is why we continue to grow our team. So we look at those statistics and say, okay, do we need to grow our financial counselors even further? And so that is a challenge that we ran into. Luckily, where Erin and her team, we kind of I guess grew our team and added TaylorMed to be a really great extension of our team to kind of help us do, like I said, a lot of those back end processes. And so we really lean heavy on one another. But those are some great challenges, and complexities that we ran into, which is why we had to grow our team even more. And 8 is not a magic number. If I had it my way, I think, we would have like 12 or 14, just because we would like to meet with as many new patients and not just new patients, just the established patients as well. And so we continue to navigate, through those complexities. And again, that's where we add to our team. We do have a great benefit to where we here at Highlands, we job shadow, and we have a lot of our insurance representatives or, someone who started out in insurance verification, they've learned that role, they've excelled at that role, and now they want to be patient facing. So, we have those roles that just excel and then want something new. So they flow into a patient or a financial counselor role because they have that knowledge, they have that education where they can actually benefit that patient to help understand those things. But growing our team and adding TaylorMed is definitely a bonus for us.
So what you're saying is TaylorMed, does TaylorMed apply for your grants, or does your team? So how does TaylorMed handle that? How do you handle if you have 20 oncology practices? Say this is like a scenario. You have 20 of them. Cancer Care comes open for breast cancer. And how are you applying for all that? How do you do that so quickly? Because, we have in our office, we have a searchable drug list, and we search by Cancer Care comes up. It'll bring us up our patients like right away, and it'll tell, who has what, what patient's doing what. And we work by that way. But I just wondered how TaylorMed handles that because of applying for that, because it's not open very long.
Right. Yeah. And I do not want to sound biased because I am from TaylorMed, I know. But the software does it for us. I mean, it's really, truly that simple. In the software itself, it will identify patients who, especially for those foundations like you're speaking of, are meeting criteria based on their diagnosis, their drug, and then their insurance type. So Cancer Care opens, we know that's typically for your Medicare only population. And our software then goes to work to give us a relevant patient list so that we then, when that opens, if I had 20 practices, I would have a lot of staff working those. But for Highlands Oncology, I have a team of navigators who, as soon as, especially those foundations, they kind of drop everything else they're doing and kind of go, because we know that they only are open maybe a couple minutes at a time. And, you know, it's a mad dash across the country to get patients enrolled into those. So we get as much as we can. Our software will also let us know when wait lists are available. So if those wait lists are available, we try to kind of beat the rush that way and get as many patients on the wait list as possible, so we can be prepared and kind of ahead of the mad dash, if you will. But I think, you know, one of the things, I know, Melissa, you were talking about, you know, growing your team. And I think one of the really great things about having the TaylorMed software in general is that it provides another way to show kind of like the analytics behind everything. What is your active patient volume? How many patients are kind of left unreviewed, if you will? What kind of a return are we getting on these copay claims? And, you know, tracking our free drug orders, kind of it does all of that so that, you know, we can kind of package it up nicely. And so outside of the TaylorMed Complete team, my team helping to enroll patients, you know, Melissa and her team have access to kind of our analytics dashboard that she can then use to grow her team or do whatever that she needs to do in addition to our partnership.
And to add to that, to Pam, you know, just to paint a little bit of a picture prior to TaylorMed, when those would come through, you know, like you both said, they shut down very quickly. So when we would get those to come through, it was like Russian roulette. You know, our financial counselors would be sitting with a patient actively going over a payment plan or an education of their insurance. And they would sometimes have to stop what they're doing to, you know, or if they were on the phone with a patient, you know, they would have to literally stop what they were doing and turn around and work on that, because you're right, it's such a quick process and such a quick turnaround time. You only have a short window to get those in. So those are the kind of complexities that we ran into, which led to more staff, and then us looking into a solution, you know, like TaylorMed. And I don't want to sound biased too, you know, because we do utilize TaylorMed, but they really are a great partner when it comes to a lot of the back end process, and let that platform do that for us.
Okay, thank you.
Any more questions? This is great conversation.
Sure. What is the cost, and how is the TaylorMed factored into those costs associated with the service?
You're talking about like contractually, what are we charging for the service?
Correct. You know, we have to, you know, like any institution, have to be financially, you know, viable when we 100%. Look at expanding.
Yeah, so I think every contract that we walk into is different, right? Every scenario is different, every organization is different, and the needs are different. So a lot of the times the contracts are structured based on the need. For Highlands Oncology, you know, specifically, we look at their patient population, but kind of like I mentioned earlier, what are their goals? What are they looking to achieve? That's really kind of what helps us drive success. But it also helps us understand contractually where we want to come at. A lot of the time, like I mentioned, we do what we call shared savings. So coming in to kind of share in that winning at the end. And that varies based on the size, the volume, what kind of patient load we're looking at, and then the scope that is desired by the organization.
And on-mark GPO members do receive preferred pricing. If you just reach out to advisory services or your sales rep, they can help you. Great questions. Any more? Okay. Well, thanks again for joining today's Lunch and Learn. A recording is going to be sent out shortly, as well as a brief survey if you don't mind sharing your feedback with us about the event. Again, feel free to reach out to your sales rep or email advisoryservices@mckesson.com with any more questions. Thanks so much for joining us.
Thanks for having me. Thanks, guys.
Thanks, everybody. Thank you.